I'm Dr. Matthew Wright. I'm a consultant cardiologist and electrophysiologist, practicing both at St Thomas's Hospital, London and Bupa Cromwell Hospital, London. The area in which I specialise is the treatment of arrhythmias. Patients complain of palpitations, a sudden rapid sensation of the heart beating irregularly and abnormally within the chest. Sometimes this can be a forceful heartbeat, other times this is a very rapid heartbeat. However, it can also present with collapse or extreme lethargy and a failure to be able to perform to the best of your ability. The treatment of these arrhythmias is highly specialised. Treatment normally takes place by placing a number of catheters from the groin via small incisions, smaller than the size of a biro, and wires are placed into your heart. Through looking at these catheters and the signals which are produced from your heart, we are able to diagnose what is causing the problem, and by delivering a small amount of energy, we are able to treat these arrhythmias very successfully. The majority of arrhythmias are cured with a 95% success rate, with the patient never having palpitations again. The commonest arrhythmia that patients suffer from is atrial fibrillation. This is a complex arrhythmia which requires specialist treatment. Many patients are treated with drugs alone. However, in the last 10 years, a new treatment called atrial fibrillation ablation has emerged as a very useful adjunct to medication. The success rate is much higher with ablation than it is with drugs. This procedure takes between 3 and 5 hours, and patients stay overnight and are normally discharged the day after. Often, patients require more than one procedure. However, the success rate at 5 years with multiple procedures is in the region of between 70 and 80% of patients maintaining normal rhythm throughout. Some patients require treatment of slow or fast heart rates with an implantable device. These are often known as pacemakers or cardiac defibrillators. This is another area in which I specialise in, being one of the heart rhythm. Patients with slow heart rate often collapse, as can be the case if their heart rate is excessively fast. For those patients, implantation of a pacemaker or a defibrillator is life-saving. A small device is placed under the skin, underneath the shoulder, and again this takes between an hour and an hour and a half. Following this, the patient is discharged on the same day and goes back to living a normal life. These devices can be monitored remotely via a phone line and can be reprogrammed wirelessly without the need for further operations. They last typically for around 8 years, whereby a simple operation is required to replace the battery. So, if any patient of Invictus Health suffers from palpitations, lethargy, slow or fast heart rhythms, I would be happy to make a consultation to see them and discuss their treatment further.